Hello, everyone. Dr. Tam and Rocky here again. Amazing day today. And I am so excited about this topic because this is something that we do in the office. And this is a condition that we can help with, that we have helped thousands of people with in our office. And every single day, we like to come at you and give you at your own home device or computer tips on how to decrease pain, improve your health, function, and longevity. So, Rocky, go ahead and shoot away. Let's talk about what we're going to talk about today.
All right. So pain is actually the top top reason why people go to physicians or doctors, right?
Right.
And back pain is something that most people, just like me, tend to ignore. Most of the time, we just tolerate it and think that I'm growing old, I'm just gonna live with it. And sometimes we self-diagnose, and worse, we even self-medicate, and before we know it, we become dependent on those pain relievers. But of course,
Right.
that's wrong. So today we are going to talk about sciatica, which
Ooh.
is very common. 10 to 40% of the US population has it. So imagine that. And of course, there's a lot of misconceptions, even myths about sciatica. So, because sometimes people say, I have back pain. Oh, that's sciatica, right? So those are the things that we're going to try to debunk today. So, of course, just like how we always start, Dr. Tam, what is sciatica and how do we get it in the first place?
Okay, so let's talk about what is sciatica. Sciatica is a disease, a disorder that shows up or is diagnosed when someone supposedly impinges on the sciatic nerve. Okay. So when you look at the sciatic nerve, it comes from the spine and it runs down through the glutes, the piriformis area, and down the leg, the back of the leg, sometimes to the bottom of the foot, sometimes towards the side of the foot. Okay. That's where the sciatic nerve goes to. Now, that is the medical term that shows when that nerve is really pinched, when you feel burning sensation, pain down the leg, in the back, in that pattern, that's what sciatica is. But most people don't understand sciatica that way. Most doctors, I say, don't understand sciatica that way. A lot of doctors, anytime when you have a pinch in your buttocks and it's going down the leg, boom, you have sciatica.
Yeah.
A lot of times people diagnose themselves, oh, I have pain, it goes down my butt and down the legs, now I have sciatica. But
Hmm.
what is really sciatica? So sciatica is that nerve that is inflamed, right? Something's affecting that nerve. Well, in Western medicine, we just want to treat the pain, right? All
Yeah.
day long, here's a pill, here's a shot, maybe surgery, and let's just treat the pain. The question, Rocky, becomes, where does that pain come from?
Right.
See,
Mhm.
all pain in the body, all pains in the body, no matter where it is, stems from something. And sciatic pain sometimes are truly an impingement of the sciatic nerve, but some people will call it piriformis syndrome, right? They go to the doctor. 9 times out of 10, the patient comes back, well, then my doctor told me that I have a problem with the piriformis. Well, of course you
Mhm.
have a problem with the piriformis, they might say, because they notice that your piriformis is inflamed. Well, the question then becomes, why is your piriformis inflamed? Because the piriformis is a band
Yeah.
of muscles, and sometimes the sciatic nerve runs through it. So when the piriformis is inflamed and it tightens up, it's going to pinch your sciatic nerve, which is this index finger right here. So now you get that pain going down your leg. So some people will go and take a muscle relaxer. Let's try to relax the piriformis, right? Some people might want to massage it out to begin with. 99 times out of 100, the reason why the piriformis is inflamed is because where the attachment points of the piriformis is. When the pelvis is normally positioned this way, and it's rotated one way or it's rotated another, now it's going to either pull the piriformis on one side or pull the piriformis on the other side. Well, now the piriformis, it can get pulled and stay like that for moments in time. But if it stays like that all the time, so if someone's pelvis is locked in a certain position all the time, now that piriformis is going to light you up. And when you only treat the muscle, you're not addressing the problem, because the problem, the cause of that piriformis syndrome is a malaligned pelvis or spine. So that's part of it. Now, the misdiagnosis of sciatica can also be an impingement of nerve number L3 in the lumbars, L4, or L5 in the lumbar spine, because they can kind of mimic the sciatic nerve if you or your doctor isn't really sure how the patterns of L3, L4, and L5 is. See? So that is all the misconceptions of sciatica and sometimes radiculopathy, which is from the L3, L4, L5 problems. It could be a disc problem. It could be a disc herniation. It could be an alignment problem, right? All these things. Where is the problem? Don't just take a pill for it. Where's the problem? That's what we need to know, right?
Right. And yeah, that's the problem, because most of the people, I just want to get rid of that pain, right?
It's so easy to just, hey, which pill do I take?
Yeah.
Right? But it's hard not to do that when you have commercials on TV that tells you, ask your doctor if you need whatever drug. So people then, well, there was a comedian. He says, one day there's going to be a drug commercial that says, do you go to sleep at night and wake up in the morning? and then people will be like, wait, that's me. That's me. Ask your doctor about this pill.
Right.
But he made it as a joke. But it's, I saw it was an anti-anxiety commercial. Do you get anxiety when you stand in front of a group of people and about to make a presentation? When you talk among a stage, do you have stage fright? You have anxiety. That is a stress that everyone gets. That's normal. You might as well say, does your stomach growl when you get hungry?
When you get hungry?
I mean, sometimes it's a little ridiculous, right?
It is.
So it comes down to, okay, let's find out what the real cause of the problem is.
Yeah, and that's very important. Now, speaking of that, Dr. Tam, so when we talk about pain, where does the pain manifest? Is it lower back, or is it just above my buttocks, or my leg? Where does it manifest?
Usually, sciatica comes from a misalignment of the pelvis. And over time, it inflames the muscles, which then affects the nerve. But from time to time, your S1, L5, L4, L3 nerve can be impinged due to a misalignment, right? Due to an injury, due to a disc problem, due to the bones being a problem. So it really depends. That's why a correct diagnosis is so huge, right? That's the biggest thing.
All right. Okay. And speaking of diagnosis, during the height of COVID, Dr. Tim, your clinic was open, right? And
yeah,
I'm curious, was there an influx of patients complaining or asking or even thinking that they have sciatica with the surge of the COVID-19? Was it affected or?
Yeah. So what ultimately happened is we had current patients that were going to work. But now instead of going to work, they're sitting at home. They're sitting on
Yeah.
the couch. They're sitting at their dining room table. They're sitting in the lounge chair working.
Mm-hmm.
So when your ergonomics go from good to terrible 2, 3, 4 months in, their lower back starts to hurt. You see? So then the increase of sciatica or lower back problems starts to surge. Well, on top of that, you have people that are now more sedentary. Oh, well, I
Yeah.
was watching TV and they said, I don't want to walk outside the door because there could be a lot of sick people out there and they can be infected. They could be impacted a certain way. So then a lot of people ended up sitting at home, right?
Right.
The subscription of Netflix surged.
Uh-huh.
The subscription of Amazon surged. No one even wants to go out shopping anymore, right?
Mm-hmm. Mm-hmm.
Because of COVID. So when you're sitting at home all day long in a terrible position, they're lounged back like this, right?
Right.
Well, of course, ultimately, disc problems, herniations increase. More people were going to the emergency room for back problems,
Mm-hmm.
and more people were going to us for disc, lower back pain, hip pain, knee pain, because they end up crossing their legs all day long.
Right.
You see? So these end up being a big problem. Absolutely. I would imagine you said about 40% of the people have sciatica. That's over 100 million people in the US.
Mm-hmm. Right.
I bet that number at least grew by
True.
10 to 15% over COVID.
Mm-hmm. Exactly. And I heard about one of the treatments that they could recommend for sciatica, which is the spinal decompression. How
Yes.
does it help sciatica? Or how does
Well,
the
so
treatment work?
it's huge when the problem is what we find is in your lower back and your pelvis. Because between L3, L4, L4, L5, L5S1, you have something called a disc, right? And when that disc becomes degenerated and it collapses or inflames, what's going to pinch on that nerve? So spinal
Mm-hmm.
decompression literally opens up that area, decompresses the spine, allowing the nerves to start functioning again, to breathe again. See, just imagine someone, gripping your hand all the time or your wrist. Your hand's not going to work. Well, that's what that nerve does. The moment you release the pressure, my gosh, it's night and day.
Yeah. How does the treatment work? Or
So the treatment
Mhm.
works when, first of all, you have to be diagnosed to see if there is a compression in the spine.
Mhm.
And then the treatment includes you're laying on the table, right? And the table actually is you're hooked up to a belt around your waist. And then there's a motor that we program on the computer to start pulling at a certain intensity. And it's that pumping action, higher, lower intensity, kind of like a sponge, right? You're squeezing
Yeah.
a sponge and now water goes in. If you just leave a
Mhm.
dried sponge under the water flows right through it, right? So we're pumping that disc, allowing the disc to absorb the nutrients that it needs, right? Gives it the space again. And then in the long run, well, the basis of the disc is now increased. And
Mhm.
that's what takes the pressure off the nerve. And as the pressure is taken off the nerve that has degenerated is going to start regenerating.
Mhm. All right. So it kind of somehow stretches the spine, and then
Absolutely. It stretches the
mm,
spine.
I
Yeah, it's
see.
like pumping air into your tires again.
Right.
Right? You got flat tires. Well, your car's not going to run very well. You pump it up with good amount of air. Now it's going to start running well again.
All right. Okay. And so do we have like alternatives, like alternative exercises to do at home so that we can avoid this, or so we don't further injure ourselves?
Right. So we have to look at, okay, what's causing this problem? If it's a
Mhm.
reoccurring problem, what is it? Are you lifting incorrectly? Are your ergonomics correct? Are you sitting correctly? We also have some sciatica stretch videos
Mhm.
that we've made for our patients that could be done. There's stretches, strengthening. I always tell my patients there's 3 areas in the body you want to strengthen. Okay. There is the shoulders, the upper back, and your glutes and buttocks. Those are the 3 areas you have to strengthen. But you can't just go jump right into strengthening without making sure that you're also stretching as well. So that's also huge, right? So I would urge that people to prevent the sciatica problems. Number one, make sure you're doing everything ergonomically correct, from the way you sit, the way you drive, the way you sleep, right? Those are very, very crucial. And then it's making sure that you're stretching throughout the day, right? Because your muscles, especially even if you sit correctly, your muscles can tighten up. So there are specific stretches to do, strengthening exercises, right? But also, to prevent these problems, go for a regular checkup of your spine from your doctor, your chiropractor, right? To make sure that everything's lined up the right way so that you can prevent these problems in the long run.
It's just like when you go to a dentist, make sure that
Right.
your teeth are aligned. You
Yeah.
have
How
to
do you
go
keep
to.
your teeth from rotting out?
Mm-hmm.
Well, make sure you brush. Don't eat that much candy. Make sure
Right.
you floss.
And go to the dentist.
And go to the dentist.
Mm-hmm.
Go to the
Like,
dentist for routine maintenance so your teeth never
mm-hmm.
rots.
Right,
Right.
maintenance.
Mm-hmm.
All right. Okay. Well, thank you so much, Dr. Tam, for sharing all those information to our viewers. So, um, we can probably include some of the links to exercises that our viewers can do to prevent it, or to just stretches that they can do to prevent sciatica. So thank you
Absolutely.
again, and enjoy the rest of the day, Dr. Tam.
Thank you, Rocky.
All right, bye bye.
Bye bye.